Hello everyone. Let us discuss about lymphatic drainage of head and neck. Welcome you all to Oral Medicine and Radiology Made Easy. What is lymphatic system? Lymphatic system consists of a series of tubes and filters that conveys the excess tissue fluid present in the extravascular tissue spaces back to the circulatory system. It consists of lymphatic vessels, lymph node and lymphatic capillaries. Lymphatic system consists of a series of tubes and filters that conveys the excess tissue fluid from the extravascular tissue spaces back to the circulating system. So it's basically made up of series of tubes and filters. So the parts of the lymphatic system are lymphatic capillaries, lymphatic vessels and lymphoid organs like lymph nodes, tonsils, spleen, etc. Let us understand from where the lymph originates. Lymph originates as blood plasma. In the capillary bed, the flow of blood is slowed down. So as the blood flows from artery towards the vein, it reaches the capillary bed and here the flow of blood is slowed down. And at this level, the plasma leaves the capillaries and enters the extravascular tissue spaces. Here, the exchange of nutrients, metabolites and waste product takes place. So, whatever plasma that is left the capillaries, around 90% comes back to the circulatory system. So, 90% of the tissue fluid returns to the capillary bed. Whatever 10% of tissue fluid that is present forms the lymph. I hope this is clear. The origin of lymph, it originates as blood plasma. At the capillary level, the plasma from the blood leaves the capillaries and enters the extravascular tissue spaces and becomes the tissue fluid. And 90% of the tissue fluid returns back to the capillary bed and lymph is the 10% of the tissue fluid that is left behind. What is the structure of a lymph node? Lymph node is a bean-shaped structure. It has a concave surface and a convex surface. Its size is around 1 to 2 centimeter. It has a connective tissue capsule. So, several efferent lymphatic enter at the convex surface and terminate at the hilum as a single efferent lymphatic vessel. So, lymph node is divided into mainly two parts, cortex and medulla. Cortex is again into two parts as peripheral cortex and paracortex. Peripheral cortex consists of pale staining germinal centers surrounded by dark staining lymphocytes, and this area mainly presents the B cells. So, whenever there is an antigen stimulation, the lymphocytes proliferate. As they proliferate, the proliferating lymphocytes stain pale and the mature lymphocytes stain dark, and this forms the germinal center. And next is the paracortex, which consists of T cells. Medulla consists of cords of plasma cells and some lymphocytes. So, what is the function of lymph node? It mainly filters out bacteria and cancer cells, acting as a barrier against general dissemination of the disease. As I have already mentioned, it has a function of filter. It filters out bacteria and cancer cells. Also, whenever there is an infection, it mounts the immune response. It has B lymphocytes, T lymphocytes, so it helps in immune response. Whatever bacteria has been filtered by it, they perform active phagocytosis of this bacteria, and their enlargement guides the clinician in his therapy. So, based on the nodes which all are enlarged, clinician can decide which area is actually affected. Let us understand the lymph nodes of head and neck. So, lymph nodes of head and neck are mainly described as consist of horizontal chains and vertical chain. So, horizontal nodes consist of circular chain, one outer circular ring and a deep inner ring. Then there are vertical deep cervical nodes. So, superficial ring of nodes consist of occipital, mastoid, retroauricular, parotid, submandibular, buccal, submental and sublingual. All these nodes are easy to palpate as they are present on the superficial region. Next is deep inner circle of nodes, which consist of pre-laryngeal node, retropharyngeal node, pretracheal node, paratracheal node and infrahyoid node. Then there are deep cervical nodes or vertical chain, which consist of superior deep cervical nodes, jugulodigastric node, inferior deep cervical node or jugulo-omohyoid nodes. Another classification of head and neck lymph node is based on the imaging. They are divided into 7 levels. Level 1 is submandibular and submental. Level 2 is along the sternocleidomastoid, that is internal jugular chains from the skull base to the level of the carotid bifurcation. And level 3 is from the carotid bifurcation up to the level of the intersection of the omohyoid muscle with the internal jugular vein. Level 4 is the infra-omohyoid portion of the internal jugular chain. Level 5 forms the posterior triangle nodes. Level 6 is the nodes related to the thyroid gland and 7 is the mediastinal nodes. This is the imaging based neck nodal classification where the head and neck lymph nodes are divided into 7 levels. Now let us understand which all structures drain into each node. Most important node in the head and neck region is submandibular nodes. The structures which all drain into submandibular nodes are posterior floor of the mouth, maxillary sinus, maxillary teeth, mandibular canine to the second molar, part of the tongue, buccal mucosa, nose, hard palate and upper lip. They drain to the submandibular nodes. To the submental nodes, the mandibular incisors, tip of the tongue, middle chin, middle lower lip and anterior floor of the mouth. To the retropharyngeal and parotid nodes, scalp, ear, eyelid and prominence of the cheek. So suppose there is enlargement of the retropharyngeal and parotid nodes, you can suspect infection in the scalp, ear, eyelid or from the cheek. In this picture again you can see how the regions drain to different nodes. So submental node mainly has drainage from the anterior part of the mouth. Submandibular has the posterior part of the mouth, but in the tongue and the lateral lip there is crossover. Let us understand the entire scheme of lymphatic drainage of head and neck. Always remember, the lymph flows only one direction. There is no flow backwards. There is no two flow of lymph. So from the submental nodes, the lymph flows to submandibular lymph node. From the submandibular lymph node, it drains to upper deep cervical nodes. From the retropharyngeal and parotid node and also from the third molar, from the base of the tongue, tonsillar region, soft palate and mandibular, lingual gingival area, the lymph drains directly to upper deep cervical nodes. From the upper deep cervical node, the lymph drains to lower deep cervical nodes. Also from the nodes of the glands of anterior neck, the lymph drains to lower deep cervical nodes. From the lower deep cervical nodes, the lymph drains to right lymphatic duct on the right side. Here you can see the portion marked in white, the right upper body. It drains to right lymphatic duct, and from the right lymphatic duct, it drains to right subclavian vein. On the left side, that is entire left part of the body and the lower right part of the body, the lymph reaches the thoracic duct, and from the thoracic duct it drains to left subclavian vein, and both the right subclavian vein and left subclavian vein drain into superior vena cava, and this is how the lymph from different nodes enter the circulatory system. Let me repeat it once again. Always remember, flow of lymph is unidirectional. So from the submental nodes, it drains to submandibular, from the submandibular to upper deep cervical, from the retropharyngeal and parotid nodes, and also from the third molar base of the tongue, tonsillar region, it drains to upper deep cervical, from upper deep cervical to lower deep cervical, and also from the nodes of the glands of anterior neck, it drains to lower deep cervical nodes. From the right upper part of the body, the lymph nodes drain to right lymphatic duct, and from the right lymphatic duct to right subclavian vein. Left upper and lower part of the body bilaterally drains to thoracic duct, from the thoracic duct to left subclavian vein. So, this is the pattern how the lymph from the different nodes enter the circulatory system. Lymphatic drainage of tongue is slightly complicated as there is crossover. So, the anterior part of the tongue, the lateral part drains into submental nodes on either side, whereas the middle part of the tip of the tongue there is a crossover, that is the left side drains to right submental lymph node and the right side drains to left submental lymph node. Now, the middle part of the tongue, the lateral parts drain into ipsilateral submandibular nodes, whereas the central part there is a crossover and they drain into inferior deep cervical nodes. Posterior 1/3 of the tongue, the center part there is a crossover, the right side drains to left superior deep cervical nodes and the left part of the middle part of the posterior third of the tongue drains to right superior deep cervical lymph nodes, whereas the lateral part drains to ipsilateral superior deep cervical lymph nodes. There is crossover at the middle part of the tongue at each level. Tip of the tongue there is crossover to submental nodes. Middle part of the tongue there is crossover to inferior deep cervical nodes, and posterior third of the tongue there is crossover to superior deep cervical nodes, whereas the lateral part drains to ipsilateral nodes. So, lateral part of the tongue drains to submandibular node, whereas the center part drains to inferior deep cervical node, whereas posterior part of the tongue drains to superior deep cervical nodes. Lymph nodes can enlarge. Always remember, lymph nodes are palpable only when they are enlarged. Normal lymph nodes are not palpable by a clinician. So, whenever the lymph node becomes palpable, you understand that it is enlarged in size. So, what are the different causes of lymphadenopathy? Infectious diseases like TB, hepatitis, or immunologic disease like Sjogren's syndrome or rheumatoid arthritis, malignant diseases like lymphoma, leukemia, lipid storage diseases like Gaucher's disease and Niemann-Pick disease, endocrine diseases like hyperthyroidism, adrenal insufficiency, or miscellaneous causes like sarcoidosis. All these cause lymphadenopathy. With this, we come to the end of the video. Thank you.